Can you hear me there? Juan Cruz? Oh, okay. Oh, there you're up. You're in now. Okay, Juan. Okay, Juan, I can see you.
Yes.
Let me get off my screen share. Okay, good, good. Yeah, Juan, just introduce yourself and tell us what you're doing.
Yes. I mean, so am I live? Can you hear me, John?
Yes, I can. I can.
Perfect. My name is Juan Valdivia. I'm a neurosurgeon from Tampa, Florida. We're here in Port-au-Prince, Haiti, doing a mission trip for kids with hydrocephalus and spina bifida, sort of like a project shunt, if you will. And we have 5 cases booked in the OR today, 3 endoscopic third ventriculostomies, and 2 shunts. We brought shunts, donated shunts, and yeah, these are kids that are coming from the island of Lagonav in Haiti, where there's sometimes no running water, definitely no AC, and power is spotty. And these kids have nothing. So we're trying to help them and give them a better life. I'm operated with Dr. Judy Lafortune. He's a local neurosurgeon. He's the only neurosurgeon for the city. So he's a very, very busy man. And we hope to do some good today.
Very good.
So let me see if I can find him. We're trying to get the OR ready. Let me show you the OR quickly.
Yeah, that
See
would
if
be
we
good.
can.
How many ORs are there, Juan, in the clinic?
Let me see. Combien salles d'opération vous avez ici? 3 total.
3, and this is a small island. This isn't Port-au-Prince or a small island off it. It's a different clinic than the last one you were at.
Yeah, this is actually in the capital. This is where they have the hospital for surgery.
Yeah, the equipment looks quite good.
Yep. They have a endoscopic tower. They have 3 ORs here. 1, 2, and 3. And Dr. Lafortune just finished operating an intracerebral hemorrhage. So he's quite tired, but ready still, like any neurosurgeon would be. We fly on fumes sometimes. We fly on adrenaline. Every blown puke keeps you awake.
Yeah.
Here, actually, let me show you. Yes. 1 second. Let me just. Here's Dr. Lafortune, Judy Lafortune.
Good day. Welcome from Miami Beach.
Nice to meet you.
Nice to meet you. Yeah, we're televising it to our neurosurgical community.
Yes.
Live right now.
We're going live. Yeah.
Wonderful.
So I'm very happy. We're going to try to do our best, and we're going to do some hydrocephalus cases. I'm working under Judy Lafortune, who is the busiest neurosurgeon in Port-au-Prince. We already finished the intracerebral hemorrhage, and we're ready to go 5 more cases. So typical neurosurgical day, like any neurosurgeon. We're really happy to be here, and we're going to get ready. We'll be back soon. Is that okay, John?
Good. Okay. Just let us know. We're standing by.
Yep.
Right.
Thank you.
Okay,
Hey, you want to tell us about the case now, Juan, or later? Later.
What do you think?
Tell about what?
The first case.
The first case is a 3-month-old baby with a history of progressive macrocephaly. We diagnosed with a CT scan hydrocephalus, and we're going to perform a right ETV-CPC for it.
Mm-hmm.
So, yeah, we're getting ready.
Okay. We won't get in your way.
Yeah.
All right.
Give me a couple of minutes. 1 second.
Okay. Yeah, we're flying by the seat of our pants today, improvising. This is different. Doing a live surgery from another country with low bandwidth. The bandwidth been pretty good so far. It's not halting. So Juan's going to do this procedure on a microencephaly patient. He'll describe it more clearly when he starts. I guess they're just setting up now. And there's a Zoom link in the post if anybody wants to come in. Well, people will get used to it. This is live television. This is interactive live television, which is fantastic. Live with a smartphone in a different country. Now, come on. Did you ever think you'd see the day? Change it to it. Okay. Okay, we're just standing by to get back to the OR in Port-au-Prince, Haiti. Juan Valdivia, he's a spine surgeon from Tampa, Florida, originally from Ecuador. He did his residency in, believe, geez, I don't recall, somewhere in the States. Yeah, let me see here. I posted his profile. Let me get his profile. Yeah. Well, this screen fills profile. Let's see here. Okay. We're going to screen share Juan's profile. This is the second time we televised. I'm actually from Haiti. Okay, he got his degree in Peru, and he's working at the Baker Medical Group in Tampa. General, mostly it looks like a spine presence. Education. Oh, let me see here. It's not there. Let me see if I can get it somewhere else. Okay. Okay, University of Arizona residency. And looks like he went to Emory undergraduate in Atlanta. I'm not sure about that. we're not sure about the setup. We're using the smartphone. We should have a stand. There's a smartphone stand that you can buy very inexpensively. I think it's like $30 for a smartphone stand, which I don't think Juan had a chance to pick it up before he came over. Otherwise, someone's gonna have to hold the smartphone. It's gonna be a human camera holder. And I really can't see. This is the first time we've done this in the OR. We've done smartphone webinar broadcasts from smartphones all the time, but never in the OR. As you know, the field of vision in the OR varies depending upon where you're standing. Otherwise, you know, we basically would love to have an overhead, but you need attachments for that. And we don't have it. Hey, Juan's back. Okay, Juan.
Hey, John.
Okay, you're getting set up, huh? Okay.
Hey, John.
Yeah, okay,
We're just getting ready.
okay.
Just getting ready to the OR. So just working with basic implements, and yeah, patient's on his way, you know. Wish we had the patient already in the OR, but things are a little delayed.
Okay, can you go over again who the patient is and et cetera?
Yeah, 1 second.
Okay,
The patient is actually on its way to the OR right now.
oh, okay.
As you can see, we're getting the OR set up right now.
How big is that hospital? Is it a separate clinic or is it a hospital?
No, I see the actual hospital. It's quite big. It's the level 1 trauma center and referral for neurosurgery. Let me ask, how many beds do they have?
Oh, it's the biggest hospital in Port-au-Prince?
Yeah, yeah.
Wow.
Like one of the biggest hospitals.
Did you have to get temporary privileges or was it a lot of
Yep.
paperwork?
Yep. They didn't have they haven't had a visiting neurosurgeon for a couple of years. And since I happen to be working for this nonprofit, and I just offered my services and they were happy to have me, and I'm happy to do some pro bono work, you know.
Okay, so it wasn't the paperwork wasn't too bad getting privileges?
No, it was just a normal process, background check, etc.
Okay,
Fortunately, I passed, and we're driving, as I said earlier, on a van with tinted windows from our hotel to the hospital and back. We're not going anywhere else because the risk of kidnapping is quite high right now in Port-au-Prince, especially for physicians. So we're just doing what we can to stay safe and to help others. Yeah.
wow, that hospital looks very new almost. Is it new?
Yeah, the OR is new. The outside is it's challenging still.
Oh, it's been there a while.
Let me see if I can show you. This is the PACU area. And I mean, this is busy. Let me show you. It's a busy place.
Juan, do you see a lot of medical professionals from other countries there?
I don't see anybody. I'm the only one.
Really? Oh, okay. Wow.
Yeah.
I thought there would be many people from, not many people, but a few from France.
I don't see anybody in the hospital right now.
Okay.
So let me see if I can. Let me see if I can see where the patient is. Give me 1 second, John.
Yeah. Okay. Yeah, my impression is that there was a lot of money there from other countries because of all the hurricane and the earthquake. I know that University of Miami has an ongoing program. I'm not sure about the neurosurgical aspect of it, but I know they have a University of Miami has a working relationship with them. It's just like a 2-hour flight from here. And the University of Miami over here. No, it's more over, way over there, the other way, that way. Towards inland, couple miles, about 10 miles. Hey, Louis Borba. If anybody wants to come in the panel, they're welcome to, anyone that's listening. We're waiting for Juan, the spine surgeon from Tampa, to come back to the OR. They're prepping the patient. I don't think they even put the patient under yet. Okay, Juan's back.
John,
Yeah,
all right. Yeah, patient just got into the OR. Again, the patient induced, opening all the sterile things here. And yeah, it's working towards getting the case done. Sorry if there's some delays, that's surgery.
oh, the surgery's delayed?
No. The patient just got in the OR. Yep,
Oh, okay.
yeah. That's how things
Okay.
move. And
So the most of the patients consist of hydrocephalus and spina bifida.
yes, today is hydrocephalus. Yeah,
Hydrocephalus.
hydrocephalus and some spina bifida patients later in the week that were seen by the local surgeon. We don't have any spine cases this week, or maybe next time we'll have some spine cases to be done. But this is a very busy hospital. I mean,
Okay,
it's-
are you there to do only cases or are you going to see patients also?
We will see patients as well. Yes.
Okay. And
Yeah.
Clinic, you're going to see the patients at?
Yeah. They pre-admit the patients before surgery here, so they spend the night or 2 nights before the surgery. Yeah. In fact, I was thinking of I can show you. It's a lot of movement here.
This particular patient, has he or she been waiting for a long time for the procedure?
Can you repeat that?
Yeah, has the patient been waiting a long time to have this procedure done?
Some patients have been waiting for a year
Okay,
because there was no availability. There was hospitals are very busy hospital, or they're too busy, or there were no shunts available. So yeah, some patients have been waiting for months, if not over a year.
do they have other doctors that try to do this procedure there when there's no neurosurgeon? Does a general neurosurgeon try to do anything or no? They just, they don't do a thing.
No.
Okay.
In fact, let me see if I can show you quickly where the patients are admitted.
Okay.
1 second. Can I go see the kiddies real quick? Can I
Okay.
go see the kiddies real quick?
They're all in their gowns.
All right. Yeah, so this is where the kids are admitted before surgery. They all come from long, far away places. Laguna, right?
Laguna, Porto
Okay.
yes.
Okay.
You can go in, darling. They're in their gowns. They're ready.
I don't want to show it for the show, but yeah, they're all in their gowns ready for surgery today. And 1 second, would you?
Normally, how long is this procedure, Juan? How long generally?
I think the procedure shouldn't be, the endoscopic tracheotomy shouldn't be more than half an hour.
Okay.
But let me introduce you to the founder of the nonprofit, and
Yeah, that would be great.
one of the board members as well.
Yeah,
Let me
great.
just switch here. There you go. Go ahead.
Hello, how you doing?
We're doing great. So this is Bordeaux and I'm Alana. We have 5 patients today that will have surgery with Dr. Valdivia. So the patients have just been prepped. They're in their gowns, and they'll start in about 30 minutes. So yeah, Bordeaux has been working non-stop on this project here to set up all the children to make sure they're ready for Dr. Valdivia's trip. So they've had their CT scans, they've done all their lab work, and they're ready for today. So thank you, Bordeaux.
Oh, thank you, everybody. I know as I'm working hard, as we are working hard to make all ready, I know you others, you're working hard by your side to make it happen for today. So it's a pleasure.
So we're so happy that Dr. Valdivia is here on the ground. So we're at Hospital Bernard Neves in Port-au-Prince. And most of these patients have traveled about 10 hours. They've come from the mountains. They've come by Outtakes and by bus. So yeah, we're happy for this week, and hopefully we'll get through maybe 5 surgeries a day, but we'll see how we go.
Oh, very good. Now, what's it? Elena is your first name?
Alana, yes, and Bordeaux.
Now you worked with Juan the last time, right?
Yep, exactly. So actually Dr. Valdivia came to Laguna to our clinic, and he did the first neuro clinic that's ever been done on the island of Laguna. So that was amazing.
Okay, so, sir, could you describe your background?
Yes, so was that for Bordeaux?
Yes. Could you please describe your background?
Tell us about yourself, Bordeaux.
Well, I am the transportation guy, and I'm the one who is responsible all for you Haiti train in Port-au-Prince. Okay, so I can say I am a busy man in Port-au-Prince. So
okay, I guess you deal with all kinds of patients, not just neuro patients, right?
All kinds of patients. Yes.
Yes.
Okay, and it's difficult to get neurosurgeons to do cases like hydrocephalus.
Absolutely.
Yeah,
one in the whole country.
It's difficult for Haiti.
So how big? There must be a waiting list, right, of patients?
Long.
It's a long list.
Long list about how many? How many would you approximate?
I don't really know how many are there. And even the hospital will not be able to answer that question because the one who informed about that mission, so come to the hospital, okay? But others, there is no way to contact others. Probably they didn't know, because as soon as they know the message, they're gonna come down to the hospital to see if they can be admitted on the list.
Oh, okay. So if there was a hydrocephalus patient, they would come to the hospital to be evaluated, or how do they arrive there? How do they come there?
Yes.
How do they travel here?
How do they travel here?
Are they referred from somebody, or they just hear about it and walk to the hospital? How do they know about it?
No, how the for you Haiti used to do that. First of all, to depend to the case. For you Haiti, like buy some tickets from plane. They let them travel by plane. Some of them used to travel by helicopter, and some of others like travel by boat and stuff like that to get to Port-au-Prince. And when they get to Port-au-Prince, so I am the man.
Oh, okay. So it's not just patients from Port-au-Prince. You have patients from all around that come from other parts of Haiti that come to your clinic. You have patients from other parts of Haiti that come to your hospital.
Oh, yeah.
Oh.
So let me see. So let's see. Do you mind if I answer that?
Oh yeah, look at it, sir. Yeah. Yes. I mean, I just explained you about like the island of Laguna. Okay, for the people of the island of Laguna, but all around Haiti, people come all over from the north, from the south, you know, from west and southwest, etc. Now people come from all over to get to the hospital because this is the only one who can find the neurosurgery.
Very good. Thank you very much.
Hey, John,
Yes.
let me see if I can flip this camera. So, yeah, so Bordeaux is a key part of this nonprofit, and we are all working under the nonprofit that was founded by Langa. And then the first case is about to start. We're gonna start walking back to the OR. Give
Okay.
me minutes, and I'll re-enter in a couple minutes, okay?
Okay, we'll stand by. Okay. There should be a time of didactic teaching, but I'm really not prepared. So we're preparing for Juan Valdivia, spine surgeon from Tampa, originally from Ecuador, went to school at the University of Arizona, and does, like as I said, mostly spine surgery in Tampa. It looks like he has a general spine surgery practice. Very interested in social media, experimenting now with using social media, which is great. Being able to go to Haiti to see what is involved with the third country, a patient with hydrocephalus. How do they get care? And apparently as Juan described, or as the hospital administrator described, they get referred from local physicians, and some have to come quite a long way to the 10 hours to get to the hospital, and there's a long waiting list for patients like hydrocephalus. They don't have much surgical backup, I guess. That's probably the reason, because neurosurgeons are the only ones that do procedures like hydrocephalus. Juan says, I'm not a neurosurgeon, but I guess it takes generally about a half hour. We're going to see what we can do as far as surgical field and what's done. I'm sure a lot of people watching have seen this procedure, and it's not a mystery, but to some like myself, and it's going to be first. And I don't know much of how much we're going to see. Sometimes it's difficult to see the field of operation, and especially with limited time. We just set this up this morning, and the limited equipment. Just our equipment is limited to our smartphone in Haiti. But you know, things have got better. I can remember when the bandwidth would be horrible in a place like Port-au-Prince, but now it's workable. And in most cities I've seen, it's decent. Certainly there's been no delays. Audio seems good. The video seems good. So we'll see. And meanwhile, I'll take you on a tour of Miami. Here's a big, beautiful hotel. Someday we're going to have broadcasts come from people that give the presentations. The attendees won't travel to the conference, just the speakers will come and stay in that hotel, and we'll televise all day. And this is the area known as South Beach, the touristy part right there. It's a very nice park right there. And Metropolitan Miami is very close, 15 minutes away. It's incredible to be able to be on a beach like that, 15 minutes from downtown. No more than 15 minutes, maybe a half hour. Or 20, 25 minutes. Oh, Zainab, how you doing? Zainab is here from Africa. Hello, Zainab. From West Guinea, Africa. Can you hear me, Zainab? She is the neurosurgeon from, hello, Zainab, can you hear me? Okay.
Hey,
Juan's
John, let
back.
me show you some films.
Okay. Okay, yes, we'd love to see that.
Go. There you go. Yeah, those are that shows significant megaly, all chambers, and then Sandy Walker syndrome as well. So, Dr. Lafortune has evaluated this case, and we'll proceed with endoscopic third first. These kids come from far away. So if a shunt is placed as a first line of treatment and they need let's say, this obstruction or cell malfunction, these kids are unable to get to medical care fast enough. So ETV is preferred because there's no hardware implanted and coagulation of the coral plexus. So I'm gonna be assisting him in this surgery, and yeah, the patient's getting induced right now, and yeah, just waiting to be ready. Can you hear me?
Yes, yes. I'm just setting, I'm sorry, I'm just getting preoccupied. I'm setting up something here. I'm just setting it up. So we have a neurosurgical resident from Africa watching. Zainab, can you introduce yourself, please?
We have people from over.
Say hello to Juan Valdivia, spine surgeon from Tampa, doing volunteer work in Port-au-Prince, Haiti. Are you there, Zainab? Yeah, she has some bandwidth issues in Africa, Juan.
Yeah, that's okay.
Anyways, that's okay. So what's on tap now?
I'm sorry, John.
So what's the plan now? We're just waiting.
The plan is the patient's getting induced under anesthesia, and then we will be going in the next 5 minutes or so. So give me 1 second, okay?
Okay.
Thank you. Thank you.
We have another person coming in, Ali. See if we get Ali. How you doing, Ali? Ali, you there? Ali.
Hey there.
Hello, how you doing?
Hey there. I'm doing great. Thank you. Thank you for everything, man. You're doing a great job.
Well, it's a pleasure. Now, Ali, you know what's going on, right? They have a patient with hydrocephalus. They're doing a procedure. Like a lot of places, there's not many neurosurgeons to do these cases. Some travel as long as 10 hours. So
I mean, that's fantastic, fantastic, and the fact that we are having the privilege of watching that live is makes it more so great.
yes,
Very nice.
yes, it does. It does. Juan contacted me. Oh, there you go, Juan. Where you from, Ali? Why don't you introduce yourself to Juan?
Sure. I'm a fifth-year medical school student from Shifa College of Medicine, Islamabad, Pakistan, and I find myself interested a lot in cerebrovascular neurosurgery. Great to see you, Juan.
Hey, great to see you too. It's a pleasure. And as I said, I'm a neurosurgeon, and I mostly specialize in spine and brain tumors, but we do everything in my hospital. And yeah, we're just happy to be able to give back and do some work for free, especially when patients don't have any insurance, any healthcare coverage, in a place where medical implants are very scarce and very limited. And as I said, these kids have been waiting for months and months for surgery. I'm just happy to be here and give back.
Well, both Ali and Juan, I'm not a neurosurgeon, but a half-hour procedure, that's not too bad, really. I mean, that's not extensive amount of stuff to be done.
Correct. That's state of the art. That's state of the art.
That's yeah.
Yeah. So this kids has come from this island, which is off of the mainland in Haiti, and quite a high incidence of hydrocephalus and spina bifida and malformations. Not sure what the etiology is, but as I said, shunts will be of high risk just because they don't have medical facilities, or they definitely do not have a neurologist or a neurosurgeon in that island. And you can only get there either by boat, which takes about an hour, or by plane, and the planes don't go every day. It's so just transportation and access to care is very limited. I think that's why I think the local surgeon thinks ETV, endoscopic surgical ostomy, which needs no implants, will be a better option for such patients.
What's the procedure as far as follow-up after this patient has this procedure? Do they have to stick around the hospital, or can they go back home?
Yes. The patient will stay in the hospital 1 or 2 days, will be monitored by the neurosurgeon. It's similar healthcare, that in the US, there's no huge limitations on such as length of stay and those indicators. So the patient will stay as long as needed, and they actually are pre-admitted 1 or 2 days.
Okay, that's okay. The background, the Wi-Fi freezes occasionally. It'll be back. Well, okay, we lost him. He'll be back. It happens with Wi-Fi, as you guys know, probably.
Yeah, for sure. And great to see Miss Zainab too. She's doing a good job. I don't know if she can hear us or not.
What you mean, Juan? Juan will be back.
Well, so if I may have the prep, yeah, he's back.
Okay, Juan, you're back.
Give me 1 second. 1 second, John.
Okay.
If I may ask, John, how do you manage the time? It's you're doing one webcast and then you move to another webcast. How do you do it? It's amazing.
Well, it's like a neurosurgeon on call. You just go when you have to, and when you don't, you get sleep. You know how it is, right? And
Yeah.
you just adapt, and every day is different. So that's
very good.
Every doctor understands that. You just kind of work when you gotta. PRN.
Yeah. PRN, yes.
PRN. So, but generally the days I work, and if I'm broadcasting from India or Pakistan, it's later in the day, obviously. Pakistan's a 9-hour difference. We televise a lot, as you know, from Pakistan.
Yeah.
Well, we just televised yesterday, I think, from Pakistan. I don't recall what we did, but uh, no, we did. Oh, that's right. We did one on deep brain stimulation a couple of days ago.
Yeah.
Okay, I don't know if you were there or saw that.
Yeah, I was there. Parkinsonism. Yeah.
Right.
Yeah.
So you're a fifth-year student.
I'm a rising fifth-year medical student here at Islamabad, Pakistan, and I shall be pursuing US match.
Okay, what? You have one more year, or how much more time do you have in med school?
This is our last year. Then we would go for internship of 1 year, and then we would pursue residency.
Okay, it's not a neurosurgery residency in Pakistan. It's a general internship the first year.
Yeah, for first year, it's the general internship. Then one pursues. If one wants to do it in Pakistan, it's 5 year long. First 2 year are general surgery, and the remaining 3 years are neurosurgery.
Oh, okay. So then you do general surgery after your internship.
Yeah, if one wants to do in Pakistan, they go for 2 year general surgery and then neurosurgery. Yeah.
Yeah, every country is different, right?
Yeah, every
seems.
country. Yeah.
And like in Russia, I think the residency is 3 years, but that's probably after general surgery internship or whatever.
Yeah. What do you think? I think that general surgery internship prior to initiating neurosurgery is important. It kind of forms the basis.
Yeah. So 1 or 2 years, it's different in different countries. Zinab, can you hear me, Zinab?
Yes, sir, I can hear you.
Oh, good. We can hear you. Your bandwidth varies. Sometimes it's good, sometimes, but we can hear you well now.
Okay, sir, I agree.
Have you ever seen a hydrocephalus procedure? Whoop, your sound is going again. I guess your bandwidth's mixing up.
Doing one case of hydrocephalus.
Excuse me for a second.
Hello?
I gotta step away. I'll be back.
Okay, sir.
See here. We're still holding on. Okay, we're still waiting. Okay, I hope we haven't. Okay, Juan, I don't know if you're there now. But all you guys know about surgery, sometimes it's delayed. There's one. Getting back in the camera. And someone is probably holding it by hand. Okay. I'm asking Juan to unmute. So we probably won't be getting much commentary from Juan during this procedure. Perhaps Ali could narrate. Ali? Of course, I couldn't narrate. I would just say, he's putting that long stick into the brain. Ali, are you back yet from Ramadan? No. Oh, okay, maybe the local Haitian neurosurgeon, maybe we can get Juan to give a few comments. Not that this procedure is unknown to probably most of the audience. Ali, are you there? In lieu of a good view of the camera of the operating field, it'd be nice to have a commentary of what goal is wanting to be established by this procedure in hydrocephalus and the actual protocol, what's being done. They're obviously preparing now to do something. And I'm sorry, I can't comment. That's what's being done. Now, Ali, are you around? I don't want to disturb Juan as he's supervising he's probably not supervising. I think this is a pretty basic procedure. Perhaps the neurosurgeon can comment on that.
Perfect.
Okay, we got the audio.
Awesome. Hey, John.
How are you? You back? Okay, Juan, go ahead. Go ahead, Juan.
Hi. We're just starting here. Dr. Lafortune already opened Dura. We're introducing an endoscope. We're going to connect shortly.
Just leave Juan alone. Let him comment when he wants to. You just comment when you want to, Juan.
So that's the anatomy of the right ventricle, right lateral ventricle. You see the fornix. You see the foramen Monroe, thalamoestrate vein, and in the back around 7 o'clock, you see the choroid plexus right there.
Yep.
Yeah. That's masa intermedia. Yeah. Yeah, so this is here, medium lateral.
That's the floor.
Yeah. Yeah, no, wanna follow? Without cord, right?
Without. See. Yeah.
Hey, John, can you hear me?
Yes, we can hear you.
Yeah, so Dr. Lafortune already made a small ostomy on the floor of the third ventricle, and now introducing a foregut catheter to dilate the fenestration. And this is the basic technique for endoscopic third ventriculostomy.
Okay. Juan, we won't disturb you. You just comment when you want to. That's all.
Yep, no problem. Not going, huh?
Water. Save. No, there. This.
So if you see the screen, the fenestration is done. You can see flow through the floor of the third ventricle into the basal cistern. That's the purpose of the ETV, to relieve the pressure of the ventricular system and allow for outflow. You see the prepontine cistern there, cranial nerves. We don't see the vascular artery yet, but that's, you can see the back of the clivus. Correct. Very nicely done, actually. Very, very smooth.
So is there anything you want to add?
No. Actually, that was a very smooth, nice dilation. When you were pulling out the polarity, you actually were deflating slowly, so not to do much contraction. So very good. Yeah, that's actually cranial nerve going into the, yeah. Maybe either 6, maybe either cranial nerve 6 or 7. Good pulsations, yeah. I think that's reasonable. Yeah, I wouldn't do anything like that. Yeah. You see that, John? What's that? Yep. Palamoestrate vein, choroid plexus, septal vein, yeah. Wow, so many. So many.
So, ¿qué tipo de problema? Su coagulación.
Can you hear us, John?
Yes.
Okay.
No, sure.
Yeah, where's the right to your right hand?
No.
Okay, you tell me when, okay? This, I don't think this. I think it's closed. Tell me.
Right now.
Okay, on.
Wait.
So you have it at 20.
Yeah.
What's that? On. I'm never supposed to let go.
It's like this. It's a little murky.
Yeah. Do you want me to irrigate? Oh, look at that. Nice. Very good. On. Striking back into the atrium. On. Yeah. Hey, John, are you with us still?
Yes.
Perfect. So lateral fortuny is coagulating the choroid plexus now, going all the way back into the back part of the lateral ventricle into the atrium, which leads you into the temporal horn. On. Yep. Yeah, Creole speaking audience. No, I'm talking about
Welcome, Omar.
very nice. Yeah, for Dura, feel like for surgery, yeah. Yeah.
Welcome, Omar.
Yeah, that's kind of far back. Yeah, I think that's pretty good. Yeah. Yes.
Welcome, Omar. No, I'm sorry.
Stop. Yeah. Marking, huh? Yep. Can you open this file? All good? Yep. Very nice. Yep.
Peut-être diminuer maintenant. Non. Bali non, pas diminuer net, non? Bali non.
No need to do septostomy, it's already adhesive, so yeah, let's pour plexus on the other side.
Fermez. Non, presser pour pas
Really
remonter.
exposed, huh?
Yeah.
Senang kali di KBB.
John, the thought fortune is also coagulated in the choroid plexus on the left side.
Okay.
Yes.
Welcome, Edwin Para and Omar. Welcome.
Yeah, more. You good? No, I wouldn't do it. I wouldn't either. Salim? Yes. Right side. Nice and good. Yeah. Yeah. Yeah, I like it. Okay. Okay. One. One more. Good. Full continue. More irrigation. Perfect. All right, John, we're gonna let you go for a second and then we'll be back shortly, okay?
Okay. Okay, Omar, you there?
I am here, Dr. John.
Oh,
I'm with
okay.
you. Observing.
You know what we're doing, right?
Okay, I know.
Yeah, it's a neurosurgeon from Florida is going. Hey, there. Okay, there you are, Ali Hyder. The spine surgeon from Florida is went to Haiti to do a hydrocephalus case and a few other cases. Okay, Omar?
Okay, what's the question, Dr. John?
Can you hear me at all?
Okay. I am with you now.
Oh, okay, you can hear. Welcome, Omar.
Okay.
Okay, Ali. Yeah, you know what? Can you hear me, Ali?
Yes, yes. I believe you can hear me fine.
Yeah, it's better, much better. This is perfect. You know what would make this better is to have someone like you that explains what's going on. You know what I mean? Right, because he's obviously concentrating on the field. However, I don't think he would mind if someone like you kind of explained what's going on. As far, well, you probably don't know, right? You're a 50th medical student.
Yeah, I had the privilege of observing a lot of ETVs in our complex.
Oh, okay. So
it's a
you
common
might be
procedure.
able to give us some input, what's going on. Okay. So I'm going to put,
This one also.
Have a 4x4 gloss. And pencils. That's fine. This is good. Sit down. And gas. And pencils. Forceps. Mosquito. Mustard. Yeah.
The procedure is done. They're now suturing. I believe that can be observed.
okay.
Just closing right now.
Yeah, Juan, we have a well-traveled medical student that's going to explain the procedure, so you don't have to. But you let us know if the noise disturbs you.
No, go ahead.
Okay, Ali, go ahead. Just please explain to the viewing audience what's going on.
Sure. So essentially, the ventricular system of the brain is a closed circuit, and it can exhibit increased pressure secondary to any cause. Sometimes that cause cannot be taken out. So what we do is that we initially manage it conservatively. And if not able to be managed conservatively, then we go for external drain. If that does not solve the problem, we go for ventricular peritoneal shunt. But sometimes the ventricular peritoneal shunt fails too, secondary to infection, or just because the underlying cause cannot be managed by the ventricular peritoneal shunt. So in that case, we go for ETV, endoscopic third ventriculostomy. Essentially, what we try to do is that we enter the lateral ventricle. We are the lateral ventricle from the foramen of Monroe into the third ventricle. Now the floor of the third ventricle, if we pierce that, we essentially enter the prepontine space. The prepontine space is associated with the subarachnoid space. If we create a pathway that attaches the third ventricle with the prepontine space, we essentially bypass the lesion which may be present downstream from the third ventricle, essentially in the cerebral aqueduct of Sylvius or the fourth ventricle, or later down pathway in the foramen of Luschka or foramen of Magendie. Essentially,
I guess, Ali, you can't see the surgical field well, right? Do you know exactly what they're doing?
Right now, the procedure is complete. The procedure has been completed. They are now closing the skin.
Oh, okay. So I guess you really can't see that with the view. And there's an external drain now that'll be outside the head, outside the cranium.
Yes. As a safety precaution, it's advised during every neurosurgical procedure to put at least 2 drains.
All right, John.
Okay.
So can you hear me?
Yes.
Yeah, so we're done with the procedure. The ventricular system is decompressed, draining into the subarachnoid space. And I'm sorry, the basal cistern, prepontine space, and Dr. Fortuna just sutured dura, watertight.
suturing galia now and then skin. So first case done. We're gonna get ready for the second one. Thank you for being here, okay?
Okay, I'd like to thank Ali. Ali's a medical student from Islamabad, Pakistan. He gave us a little commentary. I'd like you to meet Juan Valdivia from Tampa. Ali.
Hey, Ali.
Say hello to Juan, Ali.
Hey there, Professor Juan. It was great watching you do the ETV. Good job.
Okay. Well, actually, Dr. La Fortune is the main neurosurgeon. He is the businessman in Port-au-Prince. Yeah. So that was a very nice case, actually. Very nice case. No unexpected bleeding or anything, no complications. So very happy to be here. Yeah, give us a couple minutes and we'll be back with you, okay?
Okay. Okay.
So just those both.
Yeah, we're just trying to experimenting this with this, Ali. Seeing where it goes, to see if it enhances teaching, is to see if it helps. So,
I'm pretty sure there is no downside with this activity. There is always a upside with the surgeons sharing their procedures. And essentially, ETV is gold standard, not easily accessible in every institution. So it's a privilege.
good. Well, you know, we'll learn stuff. Like today, I learned that it's good to have a commentator behind, you know, in the panel that's not in the OR, because obviously you need to concentrate in the OR, and you don't want to have that person having to bring up teaching points. You know what I mean? Maybe some neurosurgeons do it, but I mean, I think it would be better if someone outside the field provided the commentary of what's going on. But you know, it's optional. But anyways, you seem to know what's going on.
Yeah.
So you've assisted a lot of those procedures.
Yeah. There are pinealomas, refractory intracranial hypertensions. ETV is the way to go forward, and it's pretty helpful too in managing the condition. I mean, the post-op complications are pretty less, and it's a pretty easy procedure too.
Yeah, Juan just told me this morning he's going over to Haiti. We've done it once before. Of course, it's the camera. This is obviously very basic. He has a smartphone, but if in the best of worlds, if we had you could do it with a smartphone. I think there's certain stands that go above the field, because that's probably the best view for the viewer on the computer, is to have an overhead cam, but that can be done easily. The smartphones are excellent cameras. They're excellent, you know, on their own. I mean, they're such a marvelous machine, but just as a camera, they're great resolution, and you don't need an expensive setup. Just basically that some kind of rack you have to make. Because I've attempted to do that with some anatomy labs. Most of the labs have some kind of overhead setup for teaching anatomy, especially in the digital age, where you need a good view for obviously anatomy teaching. So you're going to stay in Islamabad after school to do your internship?
I would stay in for 1 year internship, and then would probably go to US for the for residency.
Where? Stay in Islamabad or go to another city?
I would try to go to USA for residency.
Oh, okay.
Yeah.
Okay, then that's a altogether different application procedure, right?
It's competitive, and that's what makes it fun.
Yeah. Well, you speak good English, that helps.
Yeah. That is helpful. Yes.
And, okay. Okay, Juan.
All right. So we're finishing up now. We're gonna turn around the room for the next case. It's gonna take a while, so I'll let you know when we're ready. If you guys are still wanting to see another case, we'll be happy to show you. But right now, really, it's nothing to show except
Yeah,
just getting
okay,
ready.
just alert me when you're ready to go on the air, and I'm just gonna end this broadcast right now. Okay, Juan, we'll see you in a bit. Okay, Ali, thank you. Just watch the internet. I'll put it up there when I go back on. Okay?